Good day. I am H. Robert Silverstein, MD, for the Preventive Medicine Center and West Hartford Cable Access TV. If you have any questions about this show, you may contact us by going to Google, plugging in my name, H. Robert Silverstein. You'll find a link there that goes to our website, and then you have places where questions can be asked by email. Today is devoted primarily to diabetes, a mostly curable condition, but a few things that we want to talk about first. If a patient were to come to the emergency room with chest pain, and the suspicion was that it might be a cardiac issue, meaning heart attack or impending heart attack, in my belief, the most efficient testing should be a coronary CT angiogram. Now, obviously, they're going to do an EKG, and they're going to do blood tests, and some hospitals have what's called ultrasensitive troponins, and decisions are being made on that basis, and that is reasonable. Everything in life is cost and benefit. So the decision about what to do about so many people coming to emergency rooms with chest pain is how to most efficiently evaluate them. And now there is this new trend towards this sensitive form of the blood test troponin, cardiac HS high sensitivity troponin, and that is probably going to be the determining factor on who gets sent home for further or for further workup outside the hospital, or who gets admitted to the hospital for the evaluation of a potential heart attack. And that test is a very sensitive test for leakage of heart-related proteins, troponin, and the test itself is very sensitive, so the smallest rise in that really implies that that patient is having a cardiac issue, which is usually due to hardening of the arteries. There are other conditions of low flow that can be associated with an elevated troponin, and low flow is not itself due to hardening of the arteries, although the treatment is medically, not surgically, somewhat the same. As always, give statins, give blood vasodilators, and like amlodipine, also called Norvasc, Procardia, and those drugs are very helpful in that condition. One of the questions I always ask is, why is this occurring? I've said this before, and I mean this both critically and not critically. Most patients, when they go to the doctor these days, are sort of handled in the following fashion. What's your problem? Here's your prescription. Have you been asked by your doctor, or have you been told by your doctor why you have high cholesterol, why you have high blood pressure, why you have high triglycerides, why you have diabetes, or for that matter, why you have many cancers? Now, the answers are known to most of those, but I cannot tell you what the cause of acute lymphatic leukemia is. But I can tell you that water pollution and fertilizers has something to do with Parkinson's disease and non-Hodgkin's lymphoma. So in all cases, you always want to consider what it is that you may be doing that is creating this problem, and therefore, what can you change so that this problem has a chance to either reverse or be improved. For instance, if you had some condition that was related to water pollution, you might want to get a water filter for yourself. All right, so going on, so this troponin test, Troponin, has come along and is making a major difference. I attend cardiology rounds at St. Francis Hospital and am impressed with the quality of the presentations by the cardiologists at St. Francis Hospital, and also the difficulty of the cases that they're talking about. But one of the things they have been very concerned about is this high sensitivity troponin test, that is being offered, I believe, at Bristol Hospital, but I don't know where else. I don't know if it's at Hartford Hospital. I know that it is not yet at St. Francis Hospital, although almost certainly it will come in time. Now, to change the subject and create a little humor, I was thinking to myself before this started, why on earth am I wearing a white coat and a stethoscope? And obviously what seems funny to me is I'm trying to show the viewing audience when they flip through channels, hey, there's a doctor, let's listen to him for a minute. And I think it's so funny that I'm trying to draw attention, hey, look at me, look at me. Anyhow, yes, there's a great deal of competition out there and people are flipping the channels. And I hope you do watch this program, and I hope you enjoy this program. Once again, if you have any issues, any questions, just contact us through my website, which you will reach by going to Google. There's a new website that I read called DuckDuckGo. Have any of you had any experience with that? It's an alternative to Google, and apparently an eternal record is not kept of where you've been. So you can use that for a greater privacy, I believe. DuckDuckGo.com. All right, to the issue of the day. It's now the fall. It's October, and winter is coming. And a number of my patients obtained this product. It's called Immune Renew. Long ago, I learned from alternative medicine, which is proving to be true in conventional medicine, that certain extracts from mushrooms, reishi and others, agaricus, and let's see what's in this. Let's see, mycelium, agaricus, cordyceps, ganoderma, and so on, astragalus. This contains what I honestly believe are this contains capsules, which I believe, when taken in adequate amount, in other words, one capsule every 3 days is not going to do a whole lot for you, does increase immunity to ward off viruses and bacterial infections. So some of my patients obtain this Immune Renew. I'm not advertising for them. I'm giving you information that I believe is correct. If you want to check it out, go look up mycelial portions of mushrooms and immune status. And of course, as you will always find about any scientific issue, that there are those on one side and those on the other side, and it is your and my responsibility to sift through that in order to make an intelligent judgment. By the way, I was flipping channels last night, and one of my interests is climatology, and I saw this guy who was unbelievable. He was so even-handed. He was so insightful. He was so knowledgeable. His name is Patrick Michaels. He works for one of the top think tanks in the United States. I believe it's Cato, which is called Libertarian, which I'm never really sure what their position is. They're sort of for the allowing people to make decisions about pregnancy and abortions, terminations, about smoking marijuana, but also about small government and more individual freedom. So in any case, I hope I have that right. If you're a libertarian and I got that wrong, please don't call me, you can call me ignorant, but please don't call me up and harass me and tell me what a jerk I am. I apologize for my lack of information already. But he was unbelievable in his showing how utter nonsense. I've read information on both sides. I'm not against being more green, which the United States is, even though we pulled out of the Paris Accord. We are the most greening nation in the world. So just because Trump pulled us out, that doesn't mean that we've given up on pollution control and making efforts to be green. I am against subsidizing anything practically, subsidizing corn growth in Iowa for the production of oils and gasoline additives. I'm against subsidizing wind and solar energy, which is way more expensive than gas-fired and coal-fired electricity. But I think they're subsidized also. So it's time for the government to get out of the subsidy business, the picking winners and losers, and just do what it's supposed to. I don't know what it's supposed to do, but we all sort of intuit that. But the concept of subsidizing seems wrong. That doesn't say that the government shouldn't send money to states for education and for Medicaid and so on, but that's not what I mean by subsidizing. I mean supporting industries, business industries. Anyhow, I'm supposed to be talking about diabetes, and I've got all these peripheral things. You might, oh, you can't see. All right, so here's a cane. I have a hip issue. I flew to Atlanta to have stem cells inserted in my left hip, and after a year and a half, I'm finally getting better. But the reason I'm showing you this cane is because of the handle. You can get this cane with this nice foam rubber handle, but there are better canes that have a thicker foam rubber handle. I had one patient who had one, and only one patient who had one, and I was very impressed with the quality of that. Now you might say, hey dummy, you can replace that foam rubber handle with a thicker one. Well, that I don't know, but the fact of the matter is get the one with the foam rubber handle if you can and where you can. So now I've talked about immune stimulation and protection from flu and bronchitis during the colder weather. It's time to, and we've talked about troponins. Now let's go through some diabetes stuff. First of all, everybody knows that diabetes is mostly weight related. Yes, you have to have a genetic predisposition, but then what makes that genetic predisposition be expressed is your weight and your diet. To change the subject and keep it the same, here is an article that was published about high protein diets, and they predispose patients to increased risk of diabetes as well as increased risk of all-cause mortality. So the high protein diets are counterproductive, and I've always felt that. The ideal diet for weight reduction is not easy, but here it is. Berries, ideally organic, cooked vegetables and vegetable soups, excluding the potato families, the red and white potatoes. Some sweet potatoes and yams are permitted, but berries, cooked vegetables, vegetable soups, and beans to stay in the fiber direction. The human body is near vegan by design or evolution, whichever way you want to say it. And in a certain sense, forgive me, O Lord, I don't care what the Bible tells you you can do or what your interpretation of what the Bible is. I'm telling you what our biology is. I have a picture that I carry on my cell phone. It shows a sort of a nasty, angry German Shepherd. Has fangs, and all these animals that eat meat have claws and fangs, and their jaw comes down like a pair of scissors all the way to the back. Ours come down to grind like a horse or a cow or a chimp or a gorilla. We're halfway through. Have I gotten to diabetes yet? I don't know. Continuing on, hey, look at me. It's Dr. Silverstein up here going crazy again. Again, I hope you get the humor and have fun with this. But anyhow, the human jaw comes down to grind. A carnivore's jaw comes down like a pair of scissors to shred the meat. And in addition, a carnivore, if you have a friendly dog, put your finger in the mouth of that dog, and all the way to the back, you'll find the teeth are sharp. We have an enzyme for digesting plant food, not protein, in our saliva. The whole picture says that we are in an essentially vegetarian body. And gee, I was about to say something that probably wasn't that polite. I was about to say, anybody who argues against that's an idiot. Well, that's not nice of me to say. I didn't say fish and chicken and meat and cheese and eggs don't taste better. I didn't say they weren't more convenient. I didn't say they weren't easier to prepare. I'm telling you what fits with our biology and why diabetes occurs in the first place, and why a high animal protein diet is dangerous in the first place. Besides high animal protein diets, predisposed to the development of osteoporosis and kidney dysfunction. Animal protein is hard on the kidneys. I know a nice dietitian who's down at Montefiore Hospital, and she's in the kidney disease section down there. And she's vegan, vegetarian herself, and she teaches that. There are hospitals, not around here that I'm aware of, that offer vegetarian meal, vegan healthy meals. Now you can put together a vegan meal at any hospital if you sort of know what you're doing, but it's not unprocessed, whole foods, organic, as it ought to be. Now, what about, I said berries, cooked vegetables, vegetable soup, and beans. The idea is that cooked vegetables are less distending to the stomach, and when the stomach eats salads, it's sort of sitting there working away pretty hard, and that creates a little bit of hunger. I believe I've talked about this, that why is bread and why are salads served before the entree in restaurants? And I think both bread and salads stimulate the appetite. So that's why I say don't eat salads. I say eat berries, cooked vegetables, vegetable soup, and beans. Anyhow, some of that may be contested. There'll be people who argue. Look, take it or leave it. If you think I'm smart and know what I'm talking about, then go with the flow. And if you think I'm a jerk, then don't pay attention. And I tell that to my patients. If you think I'm a jerk, get yourself another doctor. Don't come to me. You'd get hurt if you think if I am a jerk. All right, enough. So here is an article. This is about heart disease. Now get a load of this. The main cause of death in diabetics is cardiovascular disease. That's hardening of the arteries in the legs that predisposes to amputation. It's hardening of the arteries that leads to kidney dysfunction and dialysis, and it's also heart attack and stroke. Cardiovascular disease is the leading cause of death for both men and women in the United States, causing 800,000 deaths a year. 800,000. That equates to 1 in 3 deaths nationwide. Now, I'll tell you the truth, it used to be 1 out of 2. It used to be 1 million deaths a year, but there have been invented statins, Lipitor, Crestor, Zocor, Livalo is the new interesting favorite, which has not gone generic yet. Livalo, and in addition, angioplasty and bypass surgery. But we wouldn't have to do those things. There wouldn't be death by cardiovascular disease if people drank right, water and weak herb tea, ate right, 90+% unprocessed whole foods vegetarian, didn't smoke, exercised to the point where they had low % body fat, and the psychological one is always relevant to all of those things, and that is unrealistic expectations. Accept and deal with the difficulties of reality, and thank God that they aren't worse than they are. All right, so type 2 diabetes is one of the leading controllable risk factors for heart disease. And type 2 diabetes patients, that's the people who can usually be controlled by pills, are 4 times more likely to die of heart disease than the general population. Let's see. All right, enough of that one. Low-carb diets linked to higher all-cause mortality. That's the same information that I told you about. High fish, chicken, turkey, meat, cheese, egg diets are related to an increased risk of death overall. Now, let's see. There is a product. What do I consider the... Let's say we're working with a patient to get them to lose weight. They're either not losing weight or they are losing weight, but they still require medications. The top medications, in my best guess, for the treatment of type 2 diabetes, which is the non-insulin dependent type diabetes, even though that's not 100% true, let's back up and change the subject for a second. By the time a person becomes diabetic, they have lost 80% of their insulin-producing beta cells. So these people who are walking around and now say, well, I've got glucose intolerance and I'm now type 2 diabetic, those people have lost 80% of their capacity to produce insulin in their pancreas already. Now, what is it that can help a brother or a sister out? And the answer is, I believe, this new group of medications called the Flozins. Jardiance, Invokana, Farxiga, those are the Flozins. And what they do is they help you pee out extra sugar. There's an upside and a downside to everything. That reduces your risk of heart disease. It reduces your risk of kidney disease. It helps you lose weight. It improves your blood sugar, but there's a risk of a skin infection, which can be rather severe, and they tell people who've had cancer of the bladder not to use it because they think that high sugar environment that's sitting in your pee, which is in your bladder, is going to be helpful to any cancer cells that still might be hanging around. So the Flozins are real breakthrough. Then, even though it's an injection, it can be a once-a-week injection, and I'll bet you once a month is coming, of what I'll call the latides. And that's Bidurion, that's Ozempic. I love that ad for Ozempic. Da, 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 Ozempic. It's a famous song. But it's kind of a nifty little song. So once again, I'm playing with my stethoscope so you know I'm a doctor. It says I'm a doctor right here. Take me seriously. That's what I'm trying to convince you to do. So anyhow, these tides, the Byetta, the Bidurion, the Ozempic, those are injected medications, can be given once a week, and they too are helpful at reducing heart disease. Now it turns out the old glipizides and glimepiride, those medications, I hope I've got it right for glimepiride, I know I do for glipizide, those medications increase the risk of heart disease because they stimulate insulin production, and more insulin on already too much insulin. That's by the way, in type 2 diabetes, patients generally do not have too little insulin. They have too much insulin because the body is resistant to that insulin. It's called insulin resistance. And so the pancreas has to work overtime and over hard at producing insulin, and therefore burns itself out. So even though you've lost 80% of the insulin-producing cells, the remaining 20% are being kicked and overworked, and that's why they can eventually fail, and you move from being able to be controlled with pills to requiring insulin, even though it's entirely related to simply being overweight. Now, I'm not perfect and I'm not throwing a stone. Oh, I think I may have just messed up my microphone. But going forward, overweight is now the equivalent of smoking 15 to 20 cigarettes a day. So now those people who are walking around that are overweight and obese are the equal of pack-a-day cigarette smokers. That's the way for people to look at it. Cigarette smoking hasn't disappeared as a risk factor. There's still a large number, but it certainly has declined. By the way, to my education, I just learned today that the e-cigarettes, the electronic cigarettes, are also associated with an increased risk of developing a heart attack. Now, I just read that for the first time today, and I'm not sure whether there's some hidden statistic inside that study, but I don't think nicotine is good for people. And yes, it's better that they smoke the electronic cigarettes than the regular cigarettes or cigars or pipes that they're inhaling. And most people who smoke pipes and cigars say they're not inhaling. Truth be told, they are inhaling. Plus the fact all that tobacco and nicotine and all that smoke toxin is going to the mouth and throat. And where do you think the throat cancers, the esophageal cancers, the tongue cancers come from? And in large part, besides being related to the papillomavirus, they are also related to alcohol and tobacco. Now, I've started to talk about diet. 3 minutes left. You only have to put up with me for 3 more minutes. Can you imagine that? On the other hand, you might say, oh my God, this is terrible. Only 3 more minutes of Dr. Silverstein. Well, life moves on. Today, for the first time, I had the realization, like in the movie Apocalypse Now, Robert Duvall is kneeling down, talking to Captain Kurtz, and he says, someday this war is going to end. And for the first time ever today, I thought, at my age, someday I'm not going to be coming here. And oh, poor viewing audience, you're not going to have the ability to hear all this wisdom that I have to put out. Wisdom, nonsense, you pick and choose. Anyhow, hope you're having fun with all of this. Continuing on, the solution to pollution is dilution. That's not a true statement. I've told the story before. Eat cooked vegetables and vegetable soups. Berries as essentially the only fruit if you're trying to lose weight, because the others are too high calorie, particularly bananas. And all my overweight patients seem to just love their bananas. Don't eat bananas, you can't lose weight. And I've already told you that the fish and the chicken and the turkey and the meat and the cheese and the eggs increases the risk for kidney disease and overall mortality. Low-carb diets linked to higher all-cause mortality. No, this paper doesn't make me absolutely right, but I make me absolutely right, don't I? Anyhow, hope you're having fun with this. Didn't get to a bunch of stuff. If you have high cholesterol, this is a medication I recommend. It's called Zetia. It allows the reduction in the dose of the cholesterol-lowering medication statin. 1 minute left. So people who develop side effects from statins can have their dose reduced by taking this medication, because it sort of functions like a multiplier. One of the things about the public has not gotten the message, and neither has many doctors. Has many doctors. I was thinking, was it have or has? I wasn't sure. Regardless, the proper cholesterol level to treat to is take the total cholesterol, subtract the good, and that number has to be 90 or less. 90 or less. And if you've had a heart attack or an angioplasty or bypass surgery, it should be considerably less. So this medication Zetia, the multiplier, allows that to occur. Okay, I think that's it for today. Good day and God bless you all. I am H. Robert Silverstein, MD, for the Preventive Medicine Center and West Hartford Cable Access TV. See you next time.